what makes America the greatest country in the world.
Soldiers, sailors, Marines, airmen.
Stood up for what was right. First step in solving any problem is recognizing there is one.
It's time we started talking. Pain isn't something we talk about.
All we can ever do for our heroes is remember them. And they gave up two lives, the one they were living and the one they would have lived. They gave up everything for our country, for us. Let's pray for freedom and justice.
Only be a war if soldiers are willing to fight.
Less than 1% of Americans serving in uniform. Some veterans not getting the timely care that they need. The good news is that in recent years we've made historic investments to boost the VA budget.
What is it? Why should we care?
We should care about press freedom
because we were informed.
In democratic societies, free, diverse, and pluralist media enable public debates and are essential checks
You don't
on
look
power.
sad. Let's discuss.
Hey guys.
What's going on?
New episode. We're gonna talk about limitation of flexion, knee and ankle. As you know, if there are two medical issues that nearly every single veteran has to deal with, it's tendinitis and knee problems. So, and of course, you can always claim tendinitis or flexion of the knee or knee problems, as you can always ask for compensation for those issues.
Yep.
So if you were Army of Marine, a good bit of your time was spent trying information with improper footwear, maybe proper footwear, or maybe you will have to buy good expensive Nikes later, but you would be using like regular Army boots for first year.
Yeah.
Until you realize that you can buy Nike or something else. So, in carrying 80 pounds plus of socks and MREs in your rucksack from point A to point B could put a little bit of pressure on your knees. So if you were in the Air Force, you may have spent a good time of time crunch under or in planes. And you Navy guys and gals ran up and down steps in tight quarters. So every service member in the military, I believe, will be having some kind of knee issues at one point in his service or afterwards when you get out.
Yeah, it's definitely a good likelihood.
And in some unfortunate cases, some veterans would or might need a knee replacement or special knee prosthesis or like some kind of support for their knees and back. The question for the day is: can the veteran get a disability compensation for his knee issues? What kind of codes and what kind of regulations applies to those disabilities?
So a knee condition can get worse in time, and maybe you should request an increase in the 10% for a left and right knee until femoral syndrome. If by now there is arthritis or involvement. Service connection for the right knee degenerative joint disease has been established as directly related to military service. An evaluation of 10% is assigned from the day following the date of discharge. So
that's what you might see as in letter. So 10%, and it's established because of this or that.
Yeah.
But we'll get in different cases what you can have in different situations. So the first one would be loss of use or amputation of the bad one.
Yeah, and that's code 5256. If the knee joint is frozen in place and cannot move at all, then it is rated depending on where it's frozen at. If it's frozen in the flexation of 45 degrees or more, then it's rated at 60%. If it's frozen in the flexation between 20 and 45, then it's 50. And between 10 and 20%, it's rated 40. And between 0 and 10, it's rated 30%.
And when we talk about flexation of the knees, and pretty much when you sit and when you extend your leg, and if it goes down and up, and the angle is measured. But that's only when you sit it, so we're not talking about that condition. When you stand, and probably like when you sit it, you can flex your knees, but when you stand, you cannot flex your back. So it's different. So other code is 5163.
If the leg has been amputated, but the stump is bad and a second amputation at the thigh level is recommended, then it's rated at 60%. This one is definitely a little odd because it's rarely used, and definitely when you come as a veteran, you always question if it's properly rated, because 60% for losing your leg up to the hip and 50% for sleep apnea. Most people would probably pick sleep apnea, but this is how they rate things. Code 5164, if the amputation is at a place around the knee where the knee cannot be used at all, then it's rated at 60%, so same thing practically. Code 5165 is if the amputation is below the knee and the knee can still move, then it's rated at 40%. Again, sleep apnea is at 50.
Yeah, so your condition will also apply for additional compensation by the VA, or you can claim it as a secondary condition as well.
Yeah. So that if you have an amputation, then you're definitely going to be pushing secondary issues for sure.
So,
as you should.
Knee replacements. The first code is 5055.
If the entire knee joint has been replaced with a prosthetic, then the condition is rated at 100% for the first year after the surgery. And this period is mainly for the VA, but the DoD will also use it if the veteran is placed on TDRL before being permanently separated. After the 1 year period, the condition is given a permanent rating. If there is weakness and severe pain with motion, then it's usually rated at 60%. If the pain is not severe but does not limit the range of motion, then it's rated under under the code 5256. If it is frozen or under codes 5261 or 5262, discussed below. If it's not frozen, the minimum rating for a total knee replacement, however, is 30%, regardless of how much motion it has. And this code is only for total knee replacements. Partial replacements are rated at on the symptoms that they cause, like limited motion, pain, stuff like that.
So the most common ones, of course, is limitation of motion of the knees. And the first code is 5261.
This is if the knee is not frozen, but is limited in extension and cannot straighten all the way. Then it's rated under this code. If the leg can only straighten to within 45 degrees of being completely straight, then it's rated at 50%. If it can strain to 30%, then it's at 40, or 30 degrees, then it's at 40%. To 20 degrees, it's at 30%, and 15 degrees, it's rated at 20%, and 10 degrees, it's rated at 10%. And 5 degrees is rated at 0. So it's all about that motion. Code 5260, if the knee can straighten but cannot bend all the way, then it's rated under this code. If the knee could only bend to 15 degrees, then it's rated at 30%. If it can bend at 30 degrees, then it's rated at 20%. 45 degrees, it's rated at 10%, and anything past 60 degrees is rated at 0. Now, if the knee can move but cannot either bend all the way or straighten all the way, then it can be rated twice under the code 5261 and under code 5260. So again, it's not pyramiding, it's the fact that you got flexation and the limitation of your knee going back and forth. So if you're somewhere in between, then you could probably get both. Too much motion or dislocation. Code 5263 is a condition where the knee bends too far backward. This is sometimes a genetic condition that does not really cause any problems, and in these cases not rateable. If it is a result of an accident or injury, however, and causes a weakness and insecurity in the knee, then it's rated at 10%. code 5257, the knee can also have too much motion, instability from side to side or dislocate regularly. This can happen when the tendons and the cartilage are damaged and can no longer support the knee joint properly. If there is only slight instability, then it's rated at 10%. If there is more instability that might cause the knee to buckle or dislocate every now and then that could be rated 20%. However, if it's so unstable that it gives out or dislocates regularly, then it's 30%. And so just know that the instability can be rated in addition to other ratings for the knee. So if the knee has both limitation in motion and instability, it could be rated for both.
Yeah. So other two codes are for meniscus. So meniscus is a cartilage that helps pad the knee joint. Any cartilage condition in the knee can be rated under these codes. So the code 52, 58.
If the cartilage frequently dislocates, causing pain, swelling, and locking in the knee, it's rated at 20%. And code 5259 if the cartilage is removed and there is pain or other symptoms in the knee is rated at 10%.
Yep. Lower leg bones, first code 5262.
Any problems with the tibia or fibula bones in the lower leg are rated under this code. If there is a complete break in either bone that cannot heal and requires a brace, then it's rated at 40%. All other conditions are rated by how they affect the knee or ankle joint. If they cause serious problems, can barely use the joint at all, then it's at 30%. If the joints can be used but the condition significantly limits the amount of activity, then it's rated at 20%. And if the knee or ankle joint is affected only slightly, then it's rated at 10%.
Shortening of the leg, code 5275.
If the bones in the leg have been shortened, it is rated under this code. The shortening of the leg can occur because of trauma or surgery. This does not refer to amputation, which is rated under a different code. This code is, and any other code for the bones of the leg cannot be used together, only one or the other. If the leg is more than 4 inches shorter, it's rated at 60%. If it's 3.5 to 4 inches shorter, it's rated at 50%. If it's
3 to 3.5 inches shorter, it's rated 40%. And if it's 2.5 to 3 inches shorter, it's rated 30%. Then consequently 2 to 2.5 inches, 20%. 1.25 to 2 inches shorter is 10%.
So if you guys ever watch King of the Hill, Hank Hill's dad, Cotton, you got some legs like that, you got shortening of your fibula or tibial bones for his condition, probably both.
So for other knee and leg conditions, diseases that affect the knee and leg can be found on the diseases of the musculoskeletal system. The webpage and cancer in the knee and leg can be found on the cancer and tumors of the musculoskeletal system VA page. So all other knee or leg injuries or conditions will be rated similarly to those, but we're not going to touch right now the cancer and tumors, just basically issues. And don't forget that before you go, check DBQ for knee and leg conditions that can be found as well at VA webpage. You just Google those so you know what to expect from the exams. Yeah. And we would like also to remind you about principles that would apply throughout your exam and later for your ratings.
Yeah, and so keep in mind this is what you're kind of trying to aim at. The amputation rule, any ratings for the knee and the leg cannot be combined to more than the 40% for the leg below the knee and 60 for the knee down. Painful motion, if pain is present with motion, then the minimum rating must be given. Put a little bell.
Special monthly compensation. If your condition makes it impossible to balance on or push off with your foot, you may qualify for VA special muscle compensation. You may also qualify if your legs has been amputated.
Yeah, so like drop foot issues, you might jump in on that.
The joints, when rating F5, if the knee is considered a major joint.
Pyramiding. Remember that a single condition can only be rated once. However, if a nerve condition exists and that is additional to the knee and leg condition not simply caused by it, then it can also be rated. So it's not just the one thing you're going for. Remember, you're talking about scars, bones, nerves, muscle damage, all that stuff. Probative value of the two exams on record of the condition differ. The exam with the most thorough data and performed by the most qualified person in that specialty will be the exam that the raters are supposed to base it on. And so make sure your doctor knows what they're talking about when they're trying to back you up. And of course, the tie goes to the veteran. If there are two equally strong exams with conflicting information, or if the condition can be equally rated under two different codes, then the one that gives the highest rating will be assigned. Even every conflict should be resolved in the favor of the higher rating and in the favor of the veteran. So that's why you're trying to get benefit of doubt. So make sure your evidence is building up towards the likelihood that this is due to your service and you have good odds. Accurate measurements. So it's essential that the necessary information to rate your condition is recorded by the physician in your exam. All range of motion should be measured with the was that a gonometer?
Yeah.
And with the information on this page, you should know what that needs to be measured and recorded. Make sure this happens correctly to ensure you receive the proper rating. And hospital or convalescent ratings. Some conditions require periods of hospitalization or constant medical care, like at-home nurses. Any condition that requires this is rated 100% during the intensive treatment and the recovery process. So once it ends, then the 100% rating will continue for a certain period until you're healthy. But remember that it comes down to the doctor's opinion, not our own. This period is about 3 months, unless it's directly specified in the condition ratings, so depending on what your condition's going for. Some patients may need more time to recover than others, so the physician or rating authorities can lengthen this time period as they see fit.
And, so those are kind of basic information about knees, ankle or knee flexion, and that VA disability claims involving knee disabilities are very common. One of the most common ones, along with tinnitus, and the mistakes can be made, and they are probably even more common in those cases. So study and be firm on what you have. So also knee ratings can be tricky because there are so many different factors to consider, even though that is fairly easy to understand.
Yeah.
And it is important to be aware of all the available ratings for knee disabilities in order to ensure that you are getting the highest rating possible, or at least you're getting something. The general rule regarding multiple ratings for same disability is the evaluation of the same disability under various diagnoses is to be avoided. So if you get rated for one condition for the knee, you probably cannot use the same kind of condition to be rated for something else.
Yeah.
So, however, the VA regulations specifically provide that knee joints can be evaluated under multiple diagnostic codes where there are different manifestations of the same disability. So manifestation means different situations when where you experience this or that condition. So as long as the knee disability affects you in separate and distinct ways, you can receive multiple ratings. But this is the tricky part, very tricky.
Yeah, so ratings to be aware of, the knee can be rated under many different diagnostic codes depending on the specific problem or problems caused by a knee condition. For example, there are ratings available for instability of the knee, limitation of extension, knee replacements, pain, and things like that. So it is important to be aware that of all the different ratings and whether you are entitled to compensation for multiple ratings in order to make sure the VA is giving you all of the compensation you're entitled to for your knee disability, or if you're good where you're at. But below is a list of ratings that can potentially be assigned to the same underlying disability. So first one, limitation of the flexation of the knee. The diagnostic code for limitation of flexation is 5260. According to the rating criteria, if the knee can straighten but cannot bend all the way, it's rated under 5260. The different percentages available are 0, 10, 20, and 30%. These ratings are assigned based on how much the knee can bend. So the less the knee can bend, the higher the rating will be. There will be specific ranges of motion measurements that correspond with each percentage, and which will be found right here on these little links. And then the limitation of extension is the diagnostic code for limitation of extension for the knee is 5261. And this is the code that is used when the knee's mobility isn't frozen but can't straighten all the way. The different percentages available are 0, 10, 20, 30, 40, and 50. These ratings are assigned based on the knee's ability to straighten. The more the knee disability prevents the knee from straightening, the higher the rating is. Again, there are specific range of motion measurements that correspond with each percentage. So check that out.
Yeah, I would say there is a table at VA website where you can also look up those ratings, and that corresponds to flexion, or like how your knee flexes and how much you can straighten.
Cool.
Instability of the knee.
Yeah. So the instability of the knee is another one, and that's the diagnostic code 5257. This is used when the knee has too much motion from side to side, so it's like wobbly, like an old leg on a chair, or dislocates regularly. Instability of the knee can occur when damage to the tendons and cartilage can no longer support the knee joints properly. The different percentages available are 10, 20, and 30. The more instability present in the knee, the higher the rating. In order to get the highest rating of 30%, the knee must be so unstable that it gives out or dislocates regularly. So now you're talking like Earl Campbell looking knees, you know. Total knee replacements. If your knee disability becomes so severe that a total knee replacement is required, you'll automatically receive the temporary 100% rating for 1 year post the surgery, so you get a little bit better and heal. After that 1 year period, the knee will be rated accordingly to the severity of the remaining problems. The highest rating available for residuals of total knee replacement under the diagnostic code is 60%. The 60% rating will be assigned when there is a weakness and severe pain with motion. If the pain is not severe but you have limited range of motion in your knee will be rated according to the criteria set forth, the limitation of flexation or limitation of the extension. And partial knee replacements, unlike the total knee replacements, partial knee replacements do not have their own diagnostic code. Instead, partial knee replacements are rated accordingly to the symptoms that are caused by the replacement, such as limited motion and if it's going to give out on it.
Yeah, so as you see, there is difference between total and partial knee replacement. There is a difference also how VA calculates disability and compensation for knee replacements. So, and also the level of VA disability compensation for knee replacements is not always corresponding to what you might feel. So be firm and fight for what you have, so you get proper ratings.
Yep.
Since it's the most common, so you can get that there is more. There can be more mistakes from knee conditions and, as we said, tendinitis as well.
Yeah. So make sure if you're just getting paid for a knee sprain or something like that, they may not be looking at everything else.
Yep. So those are the most common scenarios and conditions that you might experience with knees, ankle, or knee flexion. And as always, Joe, do you have any information, research, book, movie stuff to do you would like to recommend or share?
Yeah, if you guys want to meet me, I'm with the DAD Chapter 13 in Van Nuys at the Sepulveda VA. And I work with the College of the Canyons here in Santa Clarita, so if you guys want to run into me or ask me questions personally, that's never a problem. When it comes to good books, we're talking about War is a Racket from General Butler. And if you don't know who that guy is, that is one impressive dude. And what he has to say, his opinions on war should carry some kind of weight, especially if you understand that man's background. So it's absolutely worth reading, including for our generation. It's only like 30 pages. It's worth reading, at least just getting a real man's perspective of what war is.
Yeah, if you want to watch a good movie, Zero Dark 30 recently, more or less recently came out for the war movie, was released in 2012. And it's a good one with real life soldiers who actually participated in making this movie.
Yeah, and those guys are incredible.
So, and to finish, quote the words of wisdom of the day.
We have met the enemy, and they are ours.
Oliver Hazard Perry. That's it, folks. Thanks for listening. Until next time, over and out.
Yeah, thank you.